I'm Professor Bryan Williams. I'm Chair of Medicine at University College London and a physician at the University College London hospitals, and my specialist area of interest is high blood pressure or hypertension, where I see many patients with difficult to control blood pressure. Hypertension is the name we give to high blood pressure. We have a blood pressure to generate flow of blood around the body to the vital organs, and in some cases the amount of pressure required to do that is higher than it should be. It's incredible that hypertension is remarkably common. It affects about a quarter of the adult population, and it affects about a half of people over the age of 60 because blood pressure increases as we get older. If you have high blood pressure, you're at higher risk of developing heart disease, higher risk of stroke, kidney disease, and indeed higher risk of dying prematurely from these complications. I have a number of patients in my clinic who've taken their drugs on a regular basis. They're taking lifestyle interventions. They're doing everything they can to get their blood pressure controlled, and their blood pressure is still uncontrolled. In the past 5 years, we've seen the emergence of a number of what we call device-based therapies. These are devices that have been designed to specifically target some of the mechanisms that regulate blood pressure to try and lower blood pressure without the need for further drugs, or indeed in some cases replace some of the drugs the patients are actually receiving. One of the devices that we're particularly excited about tackles a fairly fundamental mechanism for the regulation of blood pressure. In all of us, when blood pressure goes up, we have sensors here inside one of our large arteries called the carotid artery, which senses that increase in blood pressure and activates the brain to bring about mechanisms in the body that brings blood pressure down to a more natural level. So this new device has been designed to tackle that problem. The idea is that you can place a device shown here, which is the MobiusHD device, and this is inserted into the carotid artery here and imposes a degree of stretch on that artery to reactivate those sensors that then activate the brain to bring blood pressure down naturally. We've tested this in some patients, and we've seen remarkable results in patients that previously could not be controlled with drug therapy. Their blood pressure has come down fairly dramatically, and in many cases the patients have been able to reduce their medications substantially. So we're quite excited that this could be a breakthrough treatment for patients with resistant hypertension who are taking their medications and require something else to help them get their blood pressure back towards the normal level. This is still an investigational device. The MobiusHD device has been tested already in patients. We know in those patients that it did reduce blood pressure, which is what we're so excited about. We now need to do a clinical trial to prove that the MobiusHD device is effective at lowering blood pressure and is safe in a larger population of patients.